Colleagues, welcome to the Global Coalition to Address Synthetic Drug Threats, Working Group 3.3 on addressing populations in contact with the criminal justice system, including ATI. Some quick announcements. We're going to talk about the meeting schedule, the website, initiatives, and recommendations. First, want to thank you for your valued partnership and participation. While we see that the drug challenges are worsening around the world over these past months, and there's the continued emergence of new synthetic drugs that are rapidly spreading, and we're seeing countries facing national emergencies, such as in the case of Sierra Leone, which announced just last weekend that they had a national emergency over one synthetic drug called Kush. We, at the same time, are looking at the mobilization of so many nations around the world on this issue, and a lot of attention being given. At the CND, we heard many national statements from countries celebrating the global coalition and sharing the urgency of the need to address synthetic drugs. We had two global coalition meetings, one a donor coordination meeting, and one that was a catch-up meeting for coalition members. And then we heard many side events from governments, civil societies, organizations, and also international organizations. And one civil society organization, the Global Initiative for Transnational Organized Crime, had a very interesting map that showed here in red countries where illicit synthetic markets have increased in severity over the past 2 years. In orange, those where the market had remained unchanged, and the ones in green where it had decreased. So the picture is not a good one over these past couple of years. The situation is getting worse in more and more countries around the world. Now, for our meeting, we are focused now in our schedule on the fourth phase of the Global Coalition's work, action planning and implementation. We begin this month, and we will continue through July. What does that mean, action planning? Well, these sessions can either have the sharing of national experiences, and if you're interested, by the way, to present, we encourage you to follow the link in the chat that our colleague Sarah Finmore is pasting, or you could see it here also posted. And please let us know if you would like to present in the coming sessions. Second, we will be action planning through continued discussions of global initiatives, also engagement of other sectors, such as civil society and the private sector, and perhaps, if we have time, workshops and training opportunities for coalition participants. So we have currently recommendations. They were 60, but in the last session, we put some of them together. So now we have 56 recommendations in total that we are carrying forward, and those are being finalized today. That will be the first order of business, will be to review the recommendations for this sub-working group. Then from there, we will look at actions. Those are concrete measures, and I will discuss what those look like in just a bit. Okay, so there are 5 different types of actions that we can take. The first are the initiatives on the Global Coalition website. There are currently 115 initiatives across all sub-working groups. I will show you where you can find those in just a moment. But the second type of action you can take is to provide in-kind or financial support to international organizations or bilaterally to other countries to help address synthetic topics of interest. You can also adopt a new practice, a policy, a regulation, or a law. You could also consider engagement with the private sector. And you could even host a meeting, a regional or global meeting for the coalition on a thematic area of interest. So these actions will start to be identified in April. We'll be working with you all to identify those actions. You can email us again at Global Coalition at synthetic coalition at state.gov. And then we have international initiatives, and these will begin also April through August. And then we have the achievements as well. And so what we're looking there is the development of a year 1 report that will develop in July. And in September, we will be sharing that at the UN General Assembly. And then beginning in October, we enter the full implementation phase. From that point onward, we will be working through the international organizations on the initiatives in a lot of depth. And then we will be looking at outcomes that are then documented in September of the second year, 2025, in a second year report. Okay, so here are the initiatives. You'll see on the website, the central tab says initiatives. When you click on that, you will see the long list of initiatives. You can click on 3.3 and see those that relate to your sub-working group. And then you will see descriptions, you'll see activities, outcomes, and the current countries that are participating. If your country's participating, you can still email the point of contact and express interest. And if you're not, you can do the same. Now, just because you express interest does not mean that there are necessarily resources. We will do our best. The international community, the partners that will reach out to INL, and then we will be connecting with other donors and seeking the opportunity to increase those resources. But there's no guarantee. We just are at the moment are taking expressions of interest. So I want to make sure that it's clear that we will do our best to accommodate as much as possible and try to meet the demand, but it will in any case be a challenge. And I want to next talk about a new website feature. We have a discussion board for the Global Coalition. Again, there's the email that I couldn't say before, syntheticscoalition@state.gov. If you have not received the email registration link, or you've received it and misplaced it, you can email us at that email address and we will send you the registration link. So once you register for the discussion boards, this is where you will find it. You go to our website, the upper right-hand corner, you see the login screen right there. And then once you click on that, you will enter your username and password that you'll set through your email. And then here we go. Upper right-hand corner, you have your profile at the upper right-hand. And then next to that, you have the community button. So when you click on the community button, you will go then to this screen. You can add a banner. I added Washington, D.C. You can add a photograph, and then you can register for as many of these sub-working groups as you'd like. And here I'm going to click on 2.2, for example, and here is the wall. So on this news feed, like a social media site, you can say something to the group, you can provide articles, information about your country, you can add images, reports, and then just post. Here's the post that I did just 1 week ago about, as I mentioned, Sierra Leone declaring a public health emergency on the synthetic drug Kush. I added a news article from the BBC, which generated the photograph. And then our friend Donald Conte from Sierra Leone sent a message about 18 hours ago. And so, I could respond to that. Somebody else can respond. You can ask questions and have a free-flowing dialogue. So I'd like to encourage you to please use this tool to the extent possible. Okay, now the recommendations for today. I want to begin with a disclaimer, let's say, or we call it chapeau, and it reads like this. The recommendations herein are non-binding and for future government consideration where appropriate. They reflect the views of technical experts participating in the Global Coalition and do not reflect a consensus of governments or a single national position. So the reason that we added this is because while many of us participate in C&Ds and negotiate resolutions, these recommendations are not national positions. They are positions of us individually, yes, working for our governments, but as technical experts to prevent a sort of the guiding direction for the initiatives that are gonna be where we really focus on in terms of our work. So they are the overarching guidance to these concrete initiatives. So now I would like to move to the recommendations themselves. And I know I'm taking a while here, so I apologize, but there's a lot to cover today. And we're going to go right to 3.3. We've reviewed all the other ones to date because I believe we didn't get to these last time. I will read these recommendations as slowly and quickly as possible, if you can imagine that balance, and then we will open it up for discussions if there's any questions or comments before we move on to our agendas for today. So 55, strengthen institutional capacity to develop, implement, monitor, and evaluate sustainable drug treatment and recovery initiatives for those in contact with the criminal justice system, including systems development, justice, treatment, and community, for alternatives to incarceration along the justice continuum, which takes into consideration the needs of justice-involved individuals with human rights, gender, age, and cultural perspectives within countries and regions where appropriate and in accordance with national legislation and regulations. 56. Create and strengthen multi-sectoral coordination among justice, health, and social service providers, creating enhanced responses such as case care management strategies and programs to support the social reintegration of people with justice system involvement to promote recovery and reduce recidivism and promote community safety along with individual health and well-being. 57. Conduct drug law and policy analyses to identify tangible opportunities for drug treatment and recovery services, including alternatives to incarceration programs to be implemented throughout the justice continuum in accordance with national legislation and regulations. 58. Deliver evidence-based substance use treatment within jails and prisons, including rehabilitation teams and specific models to address special populations, including adolescents. Consider applying the principle of equivalence of care, ensuring that those in contact with the criminal justice system have the benefit of care equivalent to that dispensed to the general public. 59. Promote a national recovery system for those in contact with the criminal justice system with local cross-sectoral cooperation and implementation, including local political authorities, local government agencies, including education, health, social affairs, culture, sports, public security, community organizations. 60. Support evaluation capacity and conduct impact analyses regarding crime reduction and public health for countries with ATI programs. Facilitate the evaluation of processes, results, and impact of pilot programs and public policies of alternatives to incarceration, and demonstrate the benefits in reducing recidivism and other benefits compared to prison. So that concludes the recommendations. I'm going to stop sharing my screen, and I'm going to invite our co-chairs. We have Dr. Daulet Baypisov and Mr. Aris Manguera to take over, and they can begin by seeing if there's any comments on these recommendations. If not, I invite them to continue with the session for today. But the first order of business is to make sure if there's any comments, and they can be added to the chat, or people can just raise it directly. Thank you.
Спасибо, Брайан. Добрый день. Здравствуйте, участники сегодняшнего заседания. Брайан представил очень необходимую, нужную информацию. Спасибо за рекомендации, озвученные вами. Действительно, в работе глобальной коалиции мы переходим к следующему этапу. Это тоже очень важный этап. На предыдущие месяцы мы получили очень много нужных знаний, полезных знаний, информации. И теперь мы их все вместе трансформировали в рекомендации, которые были сегодня озвучены. Я считаю, что эти рекомендации достаточно подробные, они жизненные. И, скажем так, каждая страна с учетом уровня социального, экономического, политического развития сможет применить рекомендации в той или иной мере, но они будут полезны. Сайт тоже очень полезный инструмент, и тот инструмент, который внедрили, дискуссионная площадка, я также призываю всех воспользоваться ею, потому что, не дожидаясь ежемесячных наших заседаний, можно задать какие-то вопросы, получить, обменяться мнениями или получить какие-то ответы на те моменты, которые, скажем, на сегодняшний день остро стоят в той или иной стране. Та же информация, которую сказал Брайан, то, что в одной из стран уже объявили чрезвычайную ситуацию в связи с высоким ростом распространения. Это может быть страны. И любой другой синдром.
Looks like you might have frozen for just a second.
If he's frozen, perhaps our co-chair, Aris, could step in.
Hi, good morning, everyone. I'm here in Orlando, Florida, today. So as mentioned by Dr. Dolet, the website is a very important tool for the private organizations and for the governments to really have this cooperation. Um, I think by now, we'll be welcoming the next speaker for this session. This is a recap of the alternatives to incarceration framework and suggested interventions by Michelle Warabiek. Michelle.
Thank you so much. Let me take a moment so I can share my screen. And start the presentation. There we go. And welcome to all of you who are here today. Good afternoon and good evening for our co-chair and others that are in the United States, or I guess maybe now it's morning again. You know, as Brian was describing where the coalition is, it's pretty incredible to think of the journey that we've all been on together during what seems like a really short amount of time. And I know our co-chairs started to reference how much learning we've done and growing. We've learned fundamentals about treatment and care and accountability as alternatives to incarceration. We've seen a lot of examples of how it plays out in countries. And so it's really my pleasure to be invited to give us a midterm review or a recap of where we've been and maybe, you know, give some direction to where we're headed. So hopefully a lot of this will be review, but sometimes after we've learned so much, it's good to highlight those main points. So what I'll start off by reminding you is that when we have substance use in the justice system and we're taking, and this is regardless of how someone enters the justice system, the percentages of our cases that somehow touch upon people using substances are pretty remarkable. So as you can see here, 60% of individuals that are arrested test positive for a substance at the time of their arrest. Regardless of the type of crime. 62% of individuals who are arrested have never received any substance use disorder treatment, right? So almost 2/3 of the people are using substances, they haven't received treatment. And when we look at the number of people who are incarcerated, so they are sentenced to serve time as a result of their crime, 63% of those individuals have a clinical substance use disorder. So it's problematic substance use. So what happens if we use incarceration and nothing else? Generally, we can expect that within 3 years of being released from jail or prison, 68% of those people will be rearrested. Only 32% will remain in the community. So 2/3 of those individuals are going back into the justice system. And then when they are rearrested, 52% actually return to prison. And many of those are for new crimes. So that's not a very good track record. It's really not where we want our results to be. What happens when we use treatment, care, and accountability effective evidence-based practices, we see that drug use goes down by 40 to 60%. We also see a reduction in crime by 40 to 60%, and employment is boosted. And there are other social factors as well, but employment is increased by 40%. So by the addition of treatment and care and the appropriate levels and forms of accountability, we really now see the situation moving in the desired direction. So these are the outcomes that motivate ATI. I'm going to cover some of the fundamentals. Some of these are reminders again of what we talked about early on in the coalition. When we look at these alternatives to incarceration, we use the full justice system. So we start as early as when police and first responders encounter someone in the community, and they may see that it is safe and appropriate to keep that person in community-based services without taking them to the court system at all. And that is called deflection. If they are brought into the court, we have court processes available. So prosecutors and investigating magistrates at time of initial hearings and initial detention can look to see if we need to retain someone in some kind of a custodial setting. And also if it's appropriate to pursue the charges against a person, or again, if we want to employ an appropriate level of treatment and care with some accountability as an alternative to further involvement in the justice system. Judges and courts, when the case gets that far, oftentimes they may be considering a more robust, extensive drug treatment court model, where someone has some extensive justice involvement, risks for re-entering the justice system, and pretty significant treatment needs. But again, we know effective practices that can engage that person and the services and oversight they need rather than going to prison. And then there are times after conviction that someone could be released into the community under supervision, again, with treatment and care, or if they are sentenced to serve time in jail or prison. When we're looking at release, we want to, first of all, offer those treatment and services while they're in custody, but then transitioning back into the community, we know that we need to meet their needs so they don't cycle back into the justice system and you know, 2/3 and the recidivism rates that we were seeing earlier are likely to just cycle right back again. So all of these opportunities present a chance to offer the services that are needed for the best outcomes. When we look at the systems involved, so we already talked about the justice decision makers, but the justice system is going to identify people through validated screening tools to see who might need treatment services and other services. They will refer for the additional information required, and they'll make decisions on whether or not the person is appropriate for alternatives to incarceration and which program would be the best fit. They also still can offer that judicial supervision, and they have the power of holding people accountable for program requirements and accountability for their behaviors. The treatment system is obviously a huge partner. So treatment systems provide those diagnostic assessments to inform us of the level of care needed. They identify and offer the levels of care for the individual being served, and they use all the modes of care that are needed. So behavioral health, medical, pharmacological, they really want to wrap around and provide all of those clinical services. And then we also know that the individuals need help with their thinking strategies and some of their life skills. And also they need to build those protective factors, making sure that they have stable housing, food, education, employment, transportation, family supports. So all three systems are working tightly together to wrap around those individuals to help them be successful. Now, how do we hold all of those systems together and wrap around the individual? There's a system of case care management, and that really is a linkage. They partner with the client. They ensure that we understand all of the needs and the strengths of the individual, that there's a comprehensive service plan that's followed and adjusted as needed, and that we're aware of the client's progress or that patient's progress, and the justice expectations with their healthcare, with their community service care, and they're also a good partner with the community upon reintegration. When we look at the different kinds of programs, and we've learned about all different examples, the program needs to fit the needs of the individuals. And so we look at risks, those factors identified might make some likely to come back into the justice system unless we offer the support required. Some of those factors are static. They're not going to change, like the age that someone first used a substance, but some of them are dynamic. They are changeable. And so when we work with that individual, we need to work with those changeable factors. And then we also, again, need to look at the need for treatment. And you can see that when we compare these needs, it puts individuals into 4 quadrants. That upper left-hand quadrant where we have a high risk for recidivism and a high need for treatment requires the most comprehensive programs. And again, this could be a drug treatment court model where you have all of those services that I already mentioned on board in a process that may take 1.5 to 2 years to complete. The opposite quadrant, the low risk for recidivism and low need for treatment, is something that would easily fit into a deflection or prosecutorial diversion model, where you might not need treatment at all. You might do prevention or targeted prevention so that we don't see any more use of the substances and identify any protective factors that can be boosted. And then you can see in the upper right-hand quadrant, if there's a low risk for recidivism, but a high need for treatment, those are initiatives that are going to be heavily based in the community. We don't need as much of the accountability. We don't have as much of a justice interest, but we still want to take care of treatment needs. And then that lower left-hand quadrant is where we have someone that really doesn't have treatment needs, but we know that they are very likely to re-encounter the justice system. And those look more like our traditional criminal justice cases. So I am now going to tell a little bit about some of the progress that we've made. When I first visited the coalition, we talked about the International Consortium for Alternatives to Incarceration, that we were in the process of being formed. And I'm excited that we just celebrated our launch last month in Vienna at the United Nations Commission on Narcotic Drugs. We had over 260 people present representing 55 different countries. And you can see some familiar faces in the photo. Brian was there with us, our partners with Colombo Plan and UNODC. We had CCAD there, and then most of the members of my team. So Jack Charlier, Roger Peters, and myself, and then Melody Heaps participated remotely, and Marie Gray was busy behind the scenes making sure that everything worked well. So we're excited that we were launched as a project of the Colombo Plan and critically also launched as a global coalition priority. So I want to shift now and look at what we can start doing moving forward in the space of developing ATI, particularly focusing on our global coalition countries and partners. And really, we want to make sure that you are equipped to build effective ATI systems and networks. So ICADI is able to do that through 3 major pillars. We look at exploration and development of countries. And I'll show a little bit more about what those development phases look like, but we want to make sure that you're well supported during all phases of country development. We are also in the process of developing resources. We just launched last month, so not everything is done, but you can see here the kinds of resources that we are in our vision are going to be pulling together for you. Some are identifying resources that are already out there. We also want to be able to direct you to resources. So if you're just getting started, there can be a lot out there. We want to point you towards some resources that are particularly helpful for countries that are just getting started. We have an ATI Basics webinar series that I will share with you a little bit later in the presentation. We're working on developing additional curricula to supplement the ATI for Policy Leader course and also the Case Care Management course. And you can see a host of other materials that we would like to develop. And then most importantly, we are establishing networks. So we want to make sure that you're not working in isolation, that we can connect you to your colleagues globally and also to experts so that we can support all of your efforts. When we talk about country development, I remembered sharing this slide, but to also help you remember that we've identified 4 general phases of development. We have interest and exploration, so just trying to understand a little bit about what ATI is. Then we look at systems preparation, making sure that your health, justice, and community systems are prepared for ATI and that you can engage those stakeholders. When you're ready, there are trainings and workshops and action planning that can be presented to plan your initiative and get it ready to be launched, and also to start engaging in data collection and evaluation. And then phase 4 is ATI expansion. So for countries that have some experience in ATI, that maybe have a demonstration spot in one site and you'd like to expand geographically, or you're in one part of that justice continuum and you would like to have complementary programs so that you can serve more of your community. And of course, there we start looking at some policy and legislative changes to make sure you can embed your ATI practices. So now we're coming to the part where I want to give you a few things to do. The first one is really easy. We want to make sure that you join the ICADI network. Brian mentioned the coalition discussion board. So we have been active on that board, but I know not all of you are there yet. So keep an eye on the coalition discussion board. But if you also either go to our website at www.icadi.org, or if you prefer a QR code, we have one here. Please sign up to join the network. And I'm going to ask you, even if you've already signed up, sign up again, because now as part of the sign-on process, we have added a place where you can check that you are part of the Global Coalition. And what that will do is it will allow us to send out some special emails just to members of the coalition group for services and opportunities that we can provide to you specifically. So if you do nothing else today with ICADI, please make sure you join our network so that we can stay in touch. I'm also going to tell you a little bit more about our webinar series. We know that in these meetings, 5 to 7 minute presentations are usually not enough to answer all of your questions. So we have 4 fundamental webinars that we're offering. They're a full hour of education each. And as we offer them, we have recordings available. So if you miss the date that we do it live, no worries. You can go onto our website and see the recordings. And you'll see in orange that the fundamentals of ATI is coming up on May 7. So sign up for the network and you'll get an email when registration opens, or you can check back at our website. We also host monthly networking conversations. So again, at the end of a webinar, sometimes you don't have enough time to talk to the experts. We have 1 hour of conversation that we offer to follow up on those topics. An Eastern Hemisphere and a Western Hemisphere session. Again, we'll send you registration information if you're on our mailing list, or you can check on the website. And then we'll be releasing a self-assessment tool looking at your readiness of your systems for ATI, probably sometime later this year. In person, we'll be back in Vienna at the United Nations Commissions on Crime Prevention and Criminal Justice. Please let your colleagues know that we'll be there. We are presenting Monday at 1 o'clock in the afternoon and encourage them to touch base and to meet us while we're there. And then we'll also be at the ISEP and ICU DDR conference in Greece. We'll have 2 sessions, one on ATI and one on treatment for individuals in the justice system. But we are also offering country delegation office hours. So the people that are there from your country can sign up for a time to meet with us, and we can talk with you individually about some strategy. And with that, I'd like to wrap things up with a huge thank you. Again, please stay in touch. I think I already mentioned the members of the team, but you have their names and titles there. And with that, I will stop sharing and turn the session back over to the co-chairs. Thanks for having me today.
Thank you so much, Michelle, and congratulations to the launching of the ICADI. And I encourage everyone to join the ICADI network. And thank you for your very clear presentation as to the significance of treatment, care, and accountability, especially its impact to how it could actually decrease drug use, decrease crime, and increase employment. Really the challenge for us is how to actually convince the governments of this, because all of us here are really convinced of alternatives to incarceration. So how to convince the government not only to join the movement, but really to implement these particular proposals that we make. Hence our recommendations as discussed by earlier. And this is where the ATI country development framework by ICATI is very useful, really. So the government can be guided by these four phases of ATI country development. So thank you very much for that. And for the SWG 3.3, we also emphasize the participation of the civil societies in collaboration with the international organizations. For further discussion, I give back the floor to Dr. Dowlett.
Спасибо, Арис. Спасибо, Мишель. Действительно, очень полезная информация, и я думаю, что мы все воспользуемся приглашением вступить в ICATI. Мы получили, мне импонирует то, что тот подход, который используется, он похож на подход, который применяется в медицине, то есть персонализированный подход, индивидуальный подход к каждому человеку, каждому пациенту, то есть в этом схожесть. И то, что у вас есть целый алгоритм, который учитывает все аспекты, и социальные, и экономические, и медицинские аспекты, и вы проводите анализ, и потом проводите еще мониторинг, это очень классно. Я думаю, что вступив в ICATI, каждый из нас сможет получить ту полезную информацию. И опять же повторюсь, с учетом уровня развития страны, мы получим нужную и полезную информацию. Ну и то, что 3 направления будущего развития, это разработка фаз, разработка ресурсов и широкое использование работы в сетях, это тоже очень такие нужные современные инструменты, и экспертное сопровождение со стороны экспертов ICATI, это тоже это супер. Следующий наш докладчик, мы хотели бы поделиться с вами рекомендациями нашими и связи с последующими шагами, которые мы видим, как будут предприниматься. Я хочу передать слово моему сопредседателю, моему коллеге Арису Мангуэра. Арис, пожалуйста.
Thank you, Dr. Dillett. Actually, earlier, the recommendations have already been discussed and presented. So probably now we just open the floor for any additional comments or questions with regard to the recommendations and as regards the presentation made by Michelle. Any questions from the body? I'm sorry, Charlotte. Go ahead.
Okay, then I will turn the recording back on, only just to say I want to thank you all for your participation today. Thank you to our co-chairs. Thank you to Michelle for presenting. I think this now sort of concludes and finalizes the recommendations from the East session. Next week, we'll have the recommendations from the West session. And following that, then we will be posting all of these recommendations on the website. But for today, I appreciate everyone's work. A special thanks to Aris for joining us at 1 a.m. East Coast time. So thank you. We feel in good company, and good morning and afternoon to the rest of you all, wherever in the world you may be. Looking forward to seeing you all once again in our next session in May. Take care until then, everybody. Bye-bye.